Welcome to the deep dive. So, well, let's just jump right into it. Um, I want to talk to you about the American drug war. We've been That's been an issue for many, many decades. Uh, we've had seen so much upheaval as a result of this so-called war on drugs. For more than half a century, the United States has framed the global drug trade as an external threat, an invasion of narcotics crossing its borders from foreign countries. Uh, and this is carried on by criminal organizations rooted in distant soil. In doing so, it has constructed a foreign policy architecture that relies heavily on coercion, militarization, and the implicit or explicit threat of violence against other nations. This posture rests on a central claim that illegal drugs arrive in America from elsewhere, and that the primary responsibility for stopping them lies beyond US borders. Yet, this framing obscures a more fundamental reality. Drugs flow into the United States because Americans buy them. Without domestic demand, there would be no transnational supply chains. By focusing outward, the procedures, traffickers, and foreign governments rather than inward on its own patterns of consumption, the United States has externalized blame and exported instability. The logic of coercion has deep roots in the policy framework, commonly referred to as the war on drugs. Beginning in the early 1970s and intensifying through subsequent administration, US leaders portrayed narcotics as a national security threat. This rhetoric, this rhetorical move had profound implications. Once drugs were defined as a security issue rather than primarily a public health issue or a public health concern, the tools of response shifted accordingly from treatment and prevention towards interdiction, surveillance, military aid, and punitive enforcement. Foreign nations became frontline combatants in what Washington characterized as a global war. And of course, everything has to be a war. Consider the pressure applied to countries such as Mexico and Colombia, and even tiny Jamaica, with its tiny marijuana fields, when compared to massive marijuana produced in states like California, Arizona, and others. For decades, these foreign nations have faced intense diplomatic and economic leverage from Washington, often tied to anti-drug cooperation in Colombia. The late 1990s initiative known as Plan Colombia combined billions of dollars in US military assistance with counter-narcotics and counterinsurgency operations. While framed as a partnership, it operated under significant asymmetry. US funding and political backing were contingent upon aggressive eradication campaigns and security reforms aligned with American priorities. Aerial fumigation of cocoa crops, military operations in rural areas, and expanded security forces were justified as necessary to stem cocaine flows and other drugs flowing northward. Jamaica has had its fair share of that process, with its national airline being fined huge sums of money by the United States because corrupt security personnel allowed marijuana onto the national airline. Similarly, in Mexico, US backed security initiatives have fueled a militarized approach to cartel violence. Just a day ago, cartel violence flared in Mexico after the killing of an alleged major drug kingpin. The logic has been consistent. If drugs are entering the United States, the source countries must intensify enforcement. Aid packages, training programs, and intelligence sharing arrangements have often come with clear expectations. Failure to meet US benchmarks can carry consequence and huge consequences, from reductions in assistance, from reduction in assistance to diplomatic censure. The imbalance of power ensure that such cooperation frequently resembles coercion depending on the administration in power in Washington, D.C. This dynamic is reinforced by US domestic law, including certification processes that evaluate whether foreign governments are doing enough with meager or non-existent resources to combat drug production and trafficking. The underlying message is unmistakable. Align yourself and align your policies with Washington's anti-drug priorities, or risk economic and political repercussions or worse. Having your nation bombed and your leader kidnapped is also in the toolkit. In effect, the United States projects its internal drugs and anxieties outward, transforming sovereign nations into instruments of its domestic enforcement strategy. Yet this strategy sidesteps the central driver of the drug trade, American consumption. The United States remains one of the largest markets for illegal narcotics in the world. Cocaine, heroin, methamphetamine, and synthetic opioids do not spontaneously migrate northward. They are pulled by demand. Without demand, there's no supply. Traffickers respond to price signals and profit. It's the price that demands how they try to find ways to supply it. As long as millions of Americans are willing to purchase illicit substances, supply networks will adapt. No matter how many hectares of coca are eradicated, or how many kingpins are arrested or killed, the disjunction is stark. On one hand, the United States pressures foreign governments to deploy soldiers, conduct raids, and uproot crops, often destabilizing fragile regions. On the other hand, it struggles to address the socioeconomic, psychological, and cultural factors that fuel domestic drug use. Poverty, untreated mental illness, chronic pain, social isolation, and the profit-driven excesses of segments of the pharmaceutical industry all contribute to America's complex relationship with intoxicants. The opioid crisis is particularly exposed how deeply rooted domestic demand can be. Even when the initial drivers were legal prescription drugs rather than smuggled contraband. By treating drugs primarily as a foreign threat, US policy obscures uncomfortable truths about its own society. It is politically easier to blame foreign cartels than to confront structural inequality gaps in healthcare, inadequate addiction treatment, and cultural patterns of substance abuse. It is simpler to deploy the Drug Enforcement Administration abroad than to fundamentally reimagine domestic drug policy. Externalizing the problem shifts public attention away from systemic reform at home. Moreover, coercive foreign policy can produce unintended consequences that ultimately undermine its stated goals. Militarized crackdowns often fragment criminal organizations rather than eliminate them, leading to more violence as rival groups compete for territory. Crop eradication can devastate rural livelihoods without providing viable economic alternatives, pushing farmers towards other illicit activities. In some cases, security assistance has strengthened state forces implicated in human rights abuses, creating cycles of grievance and instability that outlast any temporary reduction in drug supply. There is also a moral dimension to consider. When a powerful nation uses economic leverage, aid conditionality, and security partnerships to compel other countries to adopt its preferred strategies. See the Leahy Act. It raises questions about sovereignty and accountability. The communities most affected by eradication campaigns or militarized policing are often among the poorest and least politically influential in their own countries. They bear the brunt of policies designed primarily to satisfy political imperatives in Washington, D.C. Meanwhile, domestic reform efforts within the United States have increasingly acknowledged that addiction is a public health issue. Harm reduction strategies expanded across access to treatment and criminal justice reform signal a partial shift in thinking. Yet this evaluation has not been fully mirrored in foreign policy. The outward facing posture remains heavily enforcement oriented. Even as the internal conversation grows more nuanced, this inconsistency reveals a deeper tension. The United States is willing to reconsider punishment at home, but it continues to export punitive frameworks abroad. A definitive assessment must confront a simple fact: supply follows demand. No level of coercion applied to other nations can eliminate the drug trade, so long as American consumers sustain it. Addressing root causes requires investment in mental health, services, economic opportunity, education, and evidence-based treatment. It demands confronting the social despair and the structural inequities that make drug use appealing or numbing for so many American citizens. It also requires humility, the recognition that domestic policy failures cannot be corrected through external pressure alone. None of this absolves trafficking organizations of responsibility, nor does it deny the transactional nature of criminal networks. But it does challenge the premise that the primary battlefield lies beyond US borders. And that's all we're talking about today. As long as American policy defines drugs as external invasion rather than an internal demand problem, it will continue to rely on coercive tools that strains international relationships and inflicts collateral damage. Ultimately, the cohesion and the coercion imposed by the United States on other nations in the name of drug control reflects a broader pattern in its foreign policy: the projection of domestic anxieties onto the global stage, the insistence that others solve a problem rooted in American consumption is both strategically flawed and ethically fraught. A more honest and effective approach would begin at home, acknowledging that the enduring affinity for illicit drugs in the United States cannot be bombed, fumigated, or sanctioned out of existence abroad. It must be understood, treated, and transformed within the United States. This has been the deep dive. I'll see you on the next go around.